51, Canada.
My name is Siebe Visser. I'm 64 years old and I'm a Dutchman but living in Germany. Born in Deutschland.
Je m'appelle Christine, j'ai 47 ans, je suis française.
Jerry Lawler. I'm American from Memphis, Tennessee, 26 years old.
My name is Bridget Morgenroth and I'm Austrian but I'm living in Germany and my age is 48.
I'm Victor and I'm German and my age is 52.
Hey, g'day, my name is Paul. I'm a resident of the United States but an Australian citizen by birth. So I've lived in the USA for the last 14 years and in Australia for 30 years.
Government provides medical insurance for all Canadians.
Ja, habe ich.
En France, on a une assurance médicale qui est payée par l'employeur et qui est payée aussi, qui est prélevée sur notre salaire. Donc ça représente à peu près 20% du salaire.
Yes, provided through my worker, and it probably costs me around $50 US a month.
Yes.
Yes. We have medical insurance and you are automatic in a medical insurance. It's not possible to have no medical insurance. We have to pay for it, yes.
It depends on your salary.
Currently in the United States I have medical insurance. I have that because I'm working and I have a job. You can only get the best medical insurance in America if you have a job. You can buy private insurance if you don't have a job, but it's so expensive that people wouldn't be able to afford it. And probably about 50 million Americans do not have health insurance.
See the doctor.
Wie lange wird das dauern? How long will it last?
Quand on tombe malade, il n'y a pas de problème, on va directement chez le médecin ou à l'hôpital et il n'y a aucun souci puisqu'en fait il y a une prise en charge avec l'assurance qu'on paye, plus la mutuelle qui complète les dépenses qu'on peut avoir liées à des frais de santé.
That I can go to, I'm lucky enough to go to the doctor and, pay a deductible, and it's relatively inexpensive for me.
And I am glad that we have such an insurance that I don't have to complain if it's the medicaments or the treatment is paid.
And that you can go to the doctor without paying attention to the price.
Okay. And when some relative or some close friend falls ill, who may not have that insurance, what do you think about that? That's impossible.
For us,
It's compulsory.
Yeah. Automatically, yeah.
So you have no problem about concerning the health of other people.
No.
Okay.
In the United States I'm very fortunate because I can go straight to an emergency clinic or a doctor, my family physician, and I know that I've got good coverage because I work for the Catholic Church in Chicago. My employee has good coverage, so it's peace of mind for me, my wife and my children.
No problem. Phone the doctor. Immediate attention.
Yes, das kenne ich eigentlich nicht. In meinem Land, in Deutschland, wo ich wohne, sind 90% der Leute haben eine Pflichtversicherung und nur 10% der Leute haben eine Privatversicherung. Und für die Pflichtversicherung zahlt auch die Firma, bei der die Leute arbeiten, etwa die Hälfte der Gebühren, der jährlichen Beiträge. So they pay about half of the employers pay about half of the annual fee. And in the Netherlands, there's since 2 years or 3 years now 100% compulsory national health system like in England. And then if you want extras, like a second opinion, you go to a private doctor for your own account. Sometimes even the health insurance pays for the second opinion.
Et quand la famille tombe malade, c'est la même chose, il n'y a pas de souci puisque cette assurance couvre l'ensemble de la famille.
Well, I mean, everyone I know, all my relatives have health insurance. They do have health insurance available for people, senior citizens and things like that. But I'm not quite as worried about it as others might be, I should say.
I have some family members who do not have health insurance, and it's scary if they get into a car accident, if they need an emergency root canal, they will have to go to a doctor and pay out-of-pocket expenses, which would be thousands. The greatest cause of bankruptcy in the United States is for paying medical bills.
Medicine in Canada, provided by government, very inexpensive.
Ich gehe nicht so schnell zum Arzt. I don't go that quickly to a doctor, so I always try to help myself a little bit by taking good rest, sleeping well, taking aspirin or something, also etwas Einfaches, was nicht rezeptpflichtig ist.
L'automédication, en fait, on l'évite dans la mesure où on sait qu'on peut être remboursé, donc on ne tient pas à faire l'automédication. C'est quelque chose qui n'est pas tant répandu que ça en France, vu que l'accès aux soins est gratuit.
I have self-medicated, but not because of the price.
You can buy over-the-counter medication pretty easily, but if you need a prescription, something stronger or something like antibiotics, you would need to go to a doctor. So as far as self-medicating, maybe for like a painkiller, for a headache, but mostly you would need to go to a doctor and get a prescription.
Never, no.
No?
Nothing like that. You know, of course, I take you can buy medicine over the counter, but you know, as far as self-medicating or trying some kind of other kind of treatment, no, I've never had to go to those extremes.
I tried acupuncture because I have asthma, so it helped a lot, and I also tried homeopathy. I think it's complementary to the normal medicine. It's good to do both.
I tried homeopathy also, and yeah, was successful.
I'm not so much alternative medicine in that respect, but I have a Korean naturopath, for example, that is covered in my health insurance. So I have acupuncture, get chiropractic therapy, which in America would be seen as alternate. So instead of taking painkillers to get rid of pain, we try to find the root cause of the pain, and you know, so prevention is better than cure. So I have acupuncture probably once or twice a month.
I feel sad because medicine is withheld from the sick. USA has that problem. If you're rich, then you get the medical attention. If you're poor, if you go to the hospital, they close the doors. They won't see you. What happens? People die. People die, people are neglected. In Canada, that will never happen. That will never happen.
Kann ich eigentlich nicht. In meinem Land, in Deutschland, wo ich wohne, sind 90% der Leute haben eine Pflichtversicherung und nur 10% der Leute haben eine Privatversicherung. Und für die Pflichtversicherung zahlt auch die Firma, bei der die Leute arbeiten, etwa die Hälfte der Gebühren, der jährlichen Beiträge. So they pay about half of the employers pay about half of the annual fee. And in the Netherlands, there's since 2 years or 3 years now 100% compulsory national health system like in England. And then if you want extras, like a second opinion, you go to a private doctor for your own account. Sometimes even the health insurance pays for the second opinion.
Ce que je pense au sujet des pays qui n'ont pas accès aux soins aussi facilement, je pense que c'est vraiment une situation difficile. Je trouve qu'en France, on a beaucoup de chance pour ça.
I mean, I think it's great. But, you know, there is ways to get cheap, free health care in America, even though we don't offer it to every single person. I should say, you know, there's opportunities for people to go have, you know, through church centers and things like that to offer free health care. So it's not like you can't get anything for free.
I know about several countries, but we have only private insurance. I think it's very difficult because if you don't work and you don't earn money, this means that you don't have your health being repaired.
I think I'm very glad that we have this insurance for everybody, because for people who have not a lot of money, have really problem to pay for their health, and so I think it's a better system.
Okay. Even if you are not working, you are in the public insurance. Whenever you fall ill, just go to the doctor. There is a public health service and there is a private health service.
It's different. Normally, if you work, a part of your salary is given to the insurance automatically. And there is public health care, so you can get everything from there. But there are also private health care, which is more expensive, and there you need a special insurance. The state employers, for example, have a private insurance, and they can also take the private health care.
It's good for the privileged. It's good if you can afford it. It's perhaps something that people take for granted, especially if they've had it all their life, and they would only realise when they lose their job. So for example in the United States now, where we are, unemployment is maybe 10%. So quite a few people don't have health care. So I'm very fortunate I have my job. Yeah, but I know of people who don't. And I'm sure their health suffers.
Universal health care in Canada, not only Canadian citizens, but anybody in Canada, nobody is refused medical attention for any reason. So everybody in Canada, immigrant, visitor, citizen, everybody receives universal health care, no charge.
We have many doctors. And I think the problems are limited. Die Probleme sind beschränkt auf die älteren Leute. Und es gibt immer mehr ältere Leute und die Pflegeversicherung ist sehr kompliziert. Und die Ärzte trauen sich auch nicht. The medical doctors do not dare to stop treatments. Even 90-year-old people get new hips or new hearts. And that is adding to the cost of the system unnecessarily.
I mean, like benefits for me are great, but for others, you know, it's every day, you know, is a new day, and so you know, you gotta be careful. You can't, you know, if you don't have health insurance, you can't be out riding a bike or stuff like that. You know, anywhere where you could get hurt. So, you know, there's no benefits to not having any public health insurance.
I think this is a very good system, and I think also that it helps all the people. So it's good.
Well, it's based on the premise of how we treat the least of our brothers. So it's based on the premise of everybody, it's a right, everybody should have healthcare. And so people don't mind paying higher taxes, like some European countries, paying higher taxes to help out those who can't afford it or those who are unemployed. So I think most Australians would see the benefits. Therefore, your homeless population is less, your health expectancy is higher. So I think a place like Australia, people see the benefits. In the United States, people are very hesitant to pay taxes. In the United States, the taxes are less, and people often say, that's your problem, you look after that yourself. So it's more the individual has to look after themselves. Australia, it's more the community will look after the individual. So, and America is sometimes afraid of that. When Obama was running for presidency, the Obamacare, socialised medicine, people are afraid of things that they don't know. So it takes a long time to change. No, I grew up in Australia for 30 years, so it was socialised medicine. So I've been very fortunate. I've always either had a job in America or in Australia, having socialised medicine, everybody gets. And in Australia, for example, people would pay 1.5% out of their income. So if you earn 10,000 or 10 million, everybody pays a flat tax, and that's the public healthcare. Or you can buy private healthcare on top of that. Because sometimes with public healthcare you have to wait a while. You don't always have the choice of your own doctor. So public healthcare is okay, but you can pay extra and get private healthcare in Australia as well. So you can have public and private.
Our doctors are very well trained, licensed to practice, and they're paid by the government for the services that they give. So it's in their best interests to give the best service they can, always. They refuse nobody, and their service is complete. So whether you're very wealthy or very poor, everyone receives very high caliber treatment. If you're very old or very young, if you're mentally ill, if you're handicapped, everybody, all Canadians receive very high caliber medical treatment, always.
No, it's sometimes rather the reverse. For a private patient like me, the doctors like to treat me, to give me as much treatment as possible.
Like the system like Spain has now, works better than what we have, but it's so hard to implement something like that in the United States that I don't know if it would ever happen. But as far as Spain's concerned, the system should stay in place. It seems to work, great. And everybody, I think somebody told me Spain, the people in Spain have the third longest life expectancy or whatever. So I think things probably shouldn't change,
Not
They try to
save
money. So we have the problem that the insurance, that the healthcare system is too expensive. So they try to spare a bit. And sometimes you have things that you have to pay on your own. For example, the dentist and things like this. It's not perfect, the system.
of course. Well,
or glasses, for example. And there are things you have to pay yourself.
In general, you are not treated by the insurance, you are treated by the doctors. And they treat as the best they can. And it's a matter of the doctors, whether they look for the money, and then they say that if you don't pay extra, they will not treat you as good. Or most of the doctors, they just treat you and get their money back from the insurance company.
Cool. Phoned the doctor, went down to see him in 1 hour. 20 minutes later, antibiotics,
everything.
go home, I'm all done.
Basically, I have artificial hips, and the last time was about 3 years ago when the first prosthesis was infatuated and had to be replaced. That was a very difficult and risky operation, but it all went well. Alles ist gut gelaufen und jetzt bin ich eigentlich sehr gut drauf, bin sehr gehorsam. Ich muss jetzt einmal im Jahr prüfen lassen, medical check-up every year with all the blood values to be tested against infections. And in 5 years or so we have to have a new hip again. But I do a lot of, that's helpful, a lot of preventive health care myself by being extremely fit, go to the fitness twice a week, work in the garden, do not smoke, drink only limited, get enough sleep. And my wife is a dietitian and she helps me to select the right food.
Et donc en fait, au sujet d'une expérience de soins récente, ma fille s'est blessée au genou, elle a eu besoin d'une opération. Et en fait, tout a été pris en charge et j'ai bien eu à vivre grâce à mon assurance complémentaire qui a permis de rembourser complètement l'hôpital et la médication qui a suivi. Je suis assez satisfaite des systèmes d'assurance.
Yeah, it's really been a while since I've been sick. But like I said, I pay insurance every month. Go to the doctor. I think I paid a $20 deductible. So something I had to pay to go to the doctor for what I had to go for. So it's really no hassle for me. But not like that for everybody.
I just remember about my mother. She needs a new joint for her leg, and so it was no problem that it's paid. She goes to the hospital. She goes to the rehab, and yes, everybody looks at her. I was really glad that she has insurance and that she gets all the treatment she needed.
I visited the chiropractor last week, so I knew that I was flying to Spain. So I had acupuncture done on my lower back. I have some knee problems. I have ultrasound and some therapy, some physical therapy. So to walk these steps of Granada to get up and down, I knew that I'd have to be in better shape.
If public insurance was ever threatened, all of Canada would rebel. In Canada, we see public health. We see public health as a basic right. Education, health, protection by police and courts. It's a public right. Everybody has a right to it.
You are lucky.
Yeah, I know.